Hello, I'm Asha George. I'm a professor at the School of Public Health at the University of the Western Cape in South Africa, and I'm privileged to be the current chair of Health Systems Global. It's a pleasure to welcome you to the 6th Global Symposium on Health Systems Research, otherwise known as HSR 2020. This is the biennial flagship gathering of the health policy and systems research community, convened by Health Systems Global in partnership with key agencies, donors, and members across the world. What is the symposium about? Well, it serves as a meeting point to facilitate conversations and build connections across the diverse communities that sustain health policies and systems that are critical not just for better health, but for the future sustainability of our planet, its economies, and for social justice, as COVID-19 has so amply demonstrated. Why do we meet? We seek to spark creative and critical thinking, strengthen the capacities needed to deepen understanding, and forge the alliances needed to mobilize collective action to address the challenges presented by our ever more uncertain and unequal world. We do so to advance stronger, more responsive and resilient, people-centered and just health systems for all. This is a collaborative and engaged endeavor, building bridges across the range of sectors and stakeholders that together determine health in ways that strive to be inclusive, given the power hierarchies and inequalities that mark our world, both historically and presently. 10 years on from the first Global Symposium, this anniversary edition of the Global Symposia is in some ways dramatically different from the ones that preceded it. COVID-19 challenged us to find new ways of convening the symposium through an engaging online format that harnesses the strengths of digital technology. We are overcoming some of the previous biases of face-to-face global meetings, which were only accessible to those with passports, visas, and other privileges that afforded them to travel to such meetings. Recognizing the challenges of sustaining digital interactions in our crowded COVID-19 constrained worlds, and based on member and participant feedback, we have split the program into 3 ways. First, phase 1, from the 8th to the 12th of November. It features live and on-demand sessions, including the exciting plenaries, diverse parallel sessions and panels, inspiring skills building sessions, and virtual networking. This is followed by phase 2, which will be from the 25th of November till March 2021. And that will consist of parallel sessions scheduled every 2 weeks to promote and facilitate exchange and community building around the HSR 20 sub-themes, which are 1, engaging political forces, 2, engaging social, economic, and environmental forces, and thirdly, engaging innovations. Lastly, we have the 3rd phase, which will be a culminating event to synthesize the main learnings from HSR 2020 that will take place in March 2021. Not only can participants view and take part in the sessions when they happen, but we can now access the recordings on demand through the HSR 2020 Virtual Symposium platform at a time that best suits us across the world. Sessions are also scheduled at different time zones to accommodate participants in a range of time zones. There is still time to register, so if you haven't done so already, I would encourage you to do so that you can be part of the exciting discussions, debates, and collaborations that mark health policy and systems today. Having introduced the virtual symposium as a hallmark of future health systems, we are deeply honored to welcome the Director General of the World Health Organization to share his reflections on the importance of health policy and systems research in shaping future health systems that are central to the COVID-19 response and to promoting health more broadly as part of a better world for all. Thank you.
Dear colleagues and friends, it's an honor to speak with you today. When I became Director General, universal health coverage was at the top of my agenda. It remains so. The COVID-19 pandemic has only reinforced that. The COVID-19 pandemic has exposed and exploited the inequalities in our societies and the gaps in our health systems. As with all diseases, the type of care people receive depends enormously on where they live, their insurance, and their income level. While physical distancing and hand hygiene are key weapons against the virus, for people in crowded conditions in densely populated cities or refugee camps, this may simply not be viable. In many countries, weak supply chains have impeded countries' ability to get protective equipment to frontline workers. Around the world, communities' lack of trust in health systems has been a major obstacle to fighting the pandemic, the consequence of our historic underinvestment in public health. I want to underscore the critical importance of health workers to the COVID-19 response and our health systems more broadly. These frontline workers deserve our utmost support. That means decent pay, safe working conditions, and proper training and equipment. It's not just COVID-19. Similar health system challenges face us on a range of issues, such as maternal and neonatal health, HIV, TB, and malaria, and the epidemic of non-communicable diseases. As you reimagine health systems for better health and social justice, I would like to suggest a few areas of focus. First, we must build health systems that reflect the equitable societies that we want to live in. This means political engagement. As health experts, we can address power dynamics, such as by supporting less privileged communities to stand up for their rights or questioning the unhealthy practices of powerful corporations. Second, if we're concerned about equity, then we must address the reasons that people get sick and die in the air they breathe, the food they eat, the water they drink, and the conditions in which they live and work. We know that poverty and malnutrition, low-quality housing, and exposure to environmental pollutants increase the risk of disease and affect physical and cognitive development. Historically, health systems have struggled to address these issues. We must do better. Third, multilateral and multi-sectoral approaches are more important than ever. There is a real danger during periods of stress that nations and institutions turn inward. Now, more than ever, we need to work together across traditional boundaries towards the common goal of stronger health systems. As researchers, you have a vital role to play in working closely with policymakers and health system leaders for a healthier, safer, and fairer world for everyone, everywhere. Thank you, and I wish you a productive discussion.
Thank you so much, Dr. Tedros, for your inspiring and insightful reflections on how we must rise to the challenge of re-envisioning what health systems can and must do. Thank you for your leadership of WHO and global health during the global pandemic, which has shown us just how political health leadership and global health action is. How deep the social inequalities that underpin and that are exacerbated by health emergencies are, and how critical innovation is, both technological and social, in transforming health systems. These are the themes selected by the HSG membership prior to COVID-19, and if anything, COVID-19 has confirmed how deeply relevant these themes remain to catalyzing the paradigm shifts needed in reimagining future health systems. Indeed, by being truly global, COVID-19 has shown that even if you have wealth and well-resourced health systems, they can still fail if you don't get the politics right. And if you continue to ignore the social and structural inequalities that continue to blemish our current societies. While the future holds much uncertainty, this uncertainty is also an opportunity for human creativity, collaboration, and collective action to strengthen responsive health systems as a core element of more just society. The 6th Global Symposium was to be hosted in Dubai by Health Systems Global in partnership with the Mohammed bin Rashid School of Government, Dubai in the United Arab Emirates, and the American University of Beirut in Lebanon through its Knowledge Policy Center at the Faculty of Health Sciences. It is now my honor to invite His Excellency Humaid Al Qutami, the Director General of the Dubai Health Authority, to share his thoughts as host for the virtual Global Health Systems Research Symposium. Dubai is a city of the future, historically at the crossroads of trade, and presently as a mirror image of the many complexities that mark our societies. Dynamic, urbanizing economies built with migrant labor and harnessing innovation to press up against the boundaries of our natural world, a key place from which to reimagine health systems for better health and social justice.
بسم الله الرحمن الرحيم. أصحاب السعادة، السيدات والسادة، الحضور الكريم، يسعدني أن أكون معكم اليوم في انطلاق الندوة العالمية حول أبحاث الأنظمة والسياسات الصحية التي تنظمها كلية محمد بن راشد للإدارة الحكومية بالتعاون مع مركز ترشيد السياسات الصحية التابع لكلية العلوم الصحية بالجامعة الأمريكية في بيروت، وعددا من شركائنا الاستراتيجيين ومن أبرزهم منظمة الصحة العالمية ومؤسسة بيل وليندا غيتس الخيرية. إن الندوة التي تنطلق هذا العام تحت شعار إعادة تصور الأنظمة الصحية من أجل عدالة اجتماعية وصحية أفضل، فرصة ذهبية لمناقشة مختلف التحديات الصحية، وخاصة في ظل استمرار تفشي وباء فيروس كورونا المستجد كوفيد-19. ولا يخفى على أحد أن هذا الوباء أصبح محورا ليس فقط للسياسات الصحية بل لجميع السياسات الاجتماعية والاقتصادية، كما باتت التحركات والجهود المبذولة في مواجهة هذا الوباء مؤشرا مهما تشكل مستقبل العالم وكل سكان الأرض. الحضور الكريم، إن دولة الإمارات العربية المتحدة أحرزت خطوات كبيرة في مواجهة وباء كورونا على كافة الصعد، ولعل المؤشرات الدولية التي نشرتها مجلة فورس في هذا الشأن أظهرت أن دولة الإمارات هي الأولى عربيا والتاسعة عالميا في المؤشر الدول الأكثر أمانا من فيروس كوفيد-19. وعلى الرغم من التوقعات التي تؤكد أو تفي انتهاء الجائحة خلال السنوات القليلة المقبلة، إلا أن تلك التجربة تقتضي بالضرورة إجراء تطور كبير في السياسات والأنظمة الصحية من أجل وقاية مجتمعاتنا وتمكين كل الأفراد من الحصول على خدمات رعاية صحية وفق أعلى المعايير العالمية، مما يساهم في تحقيق العدالة الاجتماعية واستشراف المستقبل. السيدات والسادة، إن كلية محمد بن راشد للإدارة الحكومية تعمل انطلاقا من رؤيتها الطموحة نحو تحقيق أفضل النتائج على مستوى الحكومة، لا سيما القطاعات الحيوية، والتي من ضمنها القطاع الصحي. وإن تواجدنا اليوم في هذا الحدث المهم له خير دليل على عزمنا على المساهمة الفاعلة من أجل حلول علمية وعملية لتحدياتنا الصحية. ونحن على ثقة بعمل كل المشاركين بروح الفريق الواحد من أجل تكامل الجهود الرامية إلى تطوير أنظمتنا الصحية لتصبح نموذجا عالميا يحتذى به في مختلف القطاعات الصحية في مختلف دول العالم. فاليوم نتطلع معا لعصر جديد في قطاع الرعاية الصحية يكون شعاره التغيير. نعم، إنه التغيير الإيجابي الذي نطمح من خلاله إلى خلق أنظمة صحية أكثر كفاءة وأكثر جودة، نتطلع إلى بحوث علمية وطبية متطورة تستطيع إنقاذ ملايين البشر حول العالم. فالطب والرعاية الصحية قبل أن تكون خدمة ومهنة هي رسالة سامية تحمل الشفاء للناس وترسل لهم الرحمة في صورة جهد وعمل. فاليوم نعتبره انطلاقة جديدة في مسيرتنا نحو توفير رعاية صحية آمنة وكريمة لكل أفراد مجتمعاتنا. وأنا أثق في قدرتكم جميعا على طرح رؤاكم وتوظيف خبراتكم وتجاربكم الرائدة، ونحن بدورنا سوف نعمل معكم من خلال توظيف كل كوادرنا البشرية من أجل تحقيق هذا الهدف السامي. ونعدكم في كلية محمد بن راشد للإدارة الحكومية أن هذا اللقاء لن يكون الأخير، وسوف نعمل بالشراكة مع كافة شركائنا في الإمارات والمنطقة والعالم لحشد المزيد من الجهود للوصول إلى أفضل النتائج لتطوير السياسات والأنظمة الصحية خلال الفترة القادمة. وفي الختام أشكركم لحسن استماعكم وأتمنى لكم كل التوفيق، والسلام عليكم ورحمة الله وبركاته.
The Eastern Mediterranean region is a vibrant and unique blend of cultures, backgrounds, and colors. Constantly moving, constantly changing, a region that bore witness to the birth of civilization and is on the front lines of technological advancement and innovation. But it is also a diversity that does not come without challenges. Being on the front lines of climate change, it is already at a disadvantage while experiencing desertification and droughts on one end and floods on the other, negatively affecting health systems and population well-being. The same diversity that gives the region its vibrance is also a cause for conflict and forced migration, with millions of people on the move, creating parallel populations with their own special health needs and challenges. And its abundance of fragile populations make it particularly at risk to global threats. And so, health systems in the EMR are forced to come up with new ways to face these challenges, and that's exactly what they're doing. For example, in Jordan, public-private partnership helps to promote the health of refugees and improve access to health care in camps while harnessing clean and renewable energy. In Somalia, technology is used to empower young women, and girls who are taught how to code use this knowledge to help influence the health literacy of their communities. In Pakistan, farmers are directed towards mitigation methods to reduce deforestation while improving their livelihoods, and advances in telemedicine allow patients in rural areas to access otherwise unreachable healthcare. Tunisia is lacking its water crisis by collaborating with different agencies to support its national master plans in wastewater treatment that will meet the growing demands of vital sectors such as agriculture. And the UAE is making innovation a way of life, racing ahead of the crowd to find solutions for the ailments of today and the challenges of tomorrow, bringing its different sectors together to support its health system and vice versa. And across the region, knowledge hubs such as the Mohammed bin Rashid School of Government and the K2P Center at the American University of Beirut are creating networks of the next generation's changemakers and positively influencing political forces for affirmative action. Health systems across the EMR are faced with critical challenges, but despite and maybe even because of this challenging context, the EMR countries continue to move forward to meet their population's needs, each in their own unique way. They are reimagining health systems for a better future.
Thank you, Your Excellency, for sharing your experience on what future health systems mean for Dubai and for the broader Eastern Mediterranean region. This region is the birthplace of so many of the innovations that are central to medical practice and our common history of shared investment in knowledge and reason. Not only must we learn from its deep historical cosmopolitan heritage and contributions to science, the region is also a place to learn about the many challenges we are all facing today. In addition to the ramifications of COVID-19, the region illustrates the socio-political complexities of urbanization, migration, non-communicable diseases, and environmental vulnerability. Activists, health practitioners, and policymakers from the region have much to share with others around the world about how health systems are marked by the celebration and contestation of civil liberties, the affirmation or erosion of gender equality, the recognition or repression of LGBTQI people. Given the vibrancy of the Arab Spring and more recent social movements, the ongoing resilience of populations enduring chronic deprivation from conflict, we have so much to learn from the region about the importance of political settlements, the depth of solidarity commitments, and the promise of social change, alongside the ingenuity of innovations that can together forge future health systems for better health and social justice. The Eastern Mediterranean region is an excellent place to look back and appreciate history and look forward to the many possibilities the future holds for us. In rising up to the challenge of looking back on what we have achieved and what we can do in the future, I can think of no better group to do this than Emerging Voices. As the thematic working group of Health Systems Global, they are a vibrant network of emerging scholars and activists at the front line of transforming health systems around the world, speaking truth to power. I am proud to welcome their contributions to the symposium.
Greetings from Emerging Voices for Global Health Network. This year, the symposium will focus on reimagining health systems for better health and social justice. For us to move forward, we first need to reflect on what has been achieved. The World Health Organization was established over 70 years ago. Since then, there has been increasing recognition that health is a fundamental human right. We see this through the demand for primary health care and more recently, the push towards universal health coverage. We have also gained insights into social, economic, and historical determinants of health. And now, more than ever, we recognize the critical role of power and politics in influencing health policy and health systems.
The world has long been progressing. Simply put, the world today is a much better place for many than it was 100 years ago or even 50 years ago. From increasing life expectancy, to lowering infant and child mortality, to declining morbidity and mortality from infectious diseases, we've made many strides towards improving the health of the global population. The journey has no doubt been turbulent, and make no mistake, the journey towards improving the health of the global population has been unevenly shared by different groups. But there is much room for hope, and yes, we have much more work to do.
Sadly, health disparities remain high between and within nations. COVID-19 has laid bare many of the deficiencies in our health systems and exposed social injustices. Looking beyond health services, our planet is at a crucial point in the climate breakdown. Movements such as Fridays for Future, Black Lives Matter, and Me Too are underscoring the urgency with which we need to address issues of injustice head-on in health systems. Young people often play a key role in these movements, impatient as we are for very good reasons.
Adding to what Sarah said, there have been widespread challenges to the notion of global solidarity in recent years, driven by factors such as rising authoritarianism and xenophobic populism. This is a troubling development during times when such solidarity is critical for us to overcome the COVID-19 pandemic and promote social justice. We are living in a period of armed conflicts in many parts of the world. Healthcare is being systematically attacked and weaponized in many of these conflicts, depriving communities of healthcare and threatening healthcare workers. Also, the politicization of research and evidence requires us to reflect on our role and how we can improve. We are really happy to see that the decolonized global health movement has gained momentum over the past few years.
So, how can we work together to improve health and wellness for communities around the world? This is our moment to think boldly and break silos and reorient health systems to address public health and social justice. We imagine health systems to be ones that are built on primary care, on accountability, on social justice, and above all, on dignity.
Technological data and social innovations can address several challenges and propel us to the future. In the last couple of months, we have been thrust into a digital world that is unprecedented. We are all Zoomers now. The digitalization of our lives has enabled more inclusive dialogue, facilitated the development of further innovations, and allowed governments and businesses to stay connected with citizens and consumers. However, approximately half of the world's population is without internet connectivity, mostly concentrated in low-income, fragile and conflict-affected countries.
Being concerned with health systems and policies, we must build trust among stakeholders and collaborate with civil society and, where possible, the private sector. Democratizing global and national health governance will be crucial in the years to come, especially to stop corruption. For years, we worked to support researchers from the Global South, facilitate locally driven context-specific research, institutionalize data and evidence in decision-making, and improvements in knowledge translation.
Finally, let me highlight that our Emerging Voices for Global Health Network has contributed to reimagining health systems. The premise for developing the network was that global health symposia paid little attention towards serving a truly global audience and focused too much on the global health stars. A decade later, it's clear that the global community of health policy and systems researchers has really welcomed the emerging voices and has accepted the need for dialogue to challenge the norms and standards that shape global inequalities. A clear agenda has been set for us: to reimagine health systems, for better health and social justice, and to foster global solidarity. Enjoy the symposium. Thank you very much.